Adriana Alvarado. I'm here to tell you a little bit about post-traumatic stress disorder, known as PTSD. Now, imagine having to relive your most devastating encounters over and over again. According to the Anxiety and Depression Association of America, P.K. Phillips suffered with night terrors and flashbacks his entire life. Not knowing why he was having these visions, he would feel endangered everywhere he walked. Every space for him would be a danger zone. The mental, physical, and sexual abuse he endured as a child to his adulthood is what caused his disorder to develop. There was even a point in his life where he was attacked at knife point, leaving him unable to sleep alone for 4 years straight. He finally got properly diagnosed at the age of 35 with PTSD. He was a part of the 3.6% of the population who suffered with PTSD. According to the World Health Organization, over 250 million people are victims of post-traumatic stress disorder, meaning you can also be a small percentage of people experiencing it. With this being said, today we are going to be explaining PTSD. We'll go into what PTSD is, how it affects people's lives, and the treatment you guys can use to help PTSD. Now, what exactly is post-traumatic stress disorder? PTSD is a disorder that is formed when someone has experienced a traumatic event in their life. It usually happens when someone's life is threatened or a major injury has occurred in their life. Depending on the event you partake in will determine which type of PTSD you have and how it can be treated. Based on Best Day Psychiatry and Counseling 1994 to 2023, there are 5 types of PTSD, starting from the less severe cases such as normal stress response, acute stress disorder, and uncomplicated PTSD, which are easier to treat as they only stem from one trauma. And now we're getting into the more severe cases such as complex and comorbid PTSD. These ones are a little bit harder to medicate and treat as they have multiple mental illnesses or multiple trauma stemming from it. Now that we explored what PTSD is, let's express what the effects of PTSD can have on people. PTSD can cause someone to develop other mental disorders. Examples of these mental disorders are depression, anxiety, eating and substance abuse disorders. And if you were already diagnosed with these disorders, you guys can also make it worse, leading to suicide or suicidal thoughts. According to the American Psychiatric Association, November 2023, PTSD affects the brain and how it regulates emotion. Because of this, PTSD activates the body whenever a situation reminds the person of the traumatic event they have gone through. These traumatic events can keep a person feeling stuck in a certain time of their life, making them relive the events over and over and over again. Now that we've discussed effects, let's explore treatment options for PTSD. There's 2 types of treatment used for PTSD. That is either medication taken by mouth or therapy. There are only 2 types of medications that are approved by the FDA, which are sertraline and Paxil. It usually takes 4 to 6 weeks for these medications to work fully, but usually you start to see a difference between 2 weeks of taking the medication. These medications help to stabilize your mood and the serotonin intake of your body. Both medications are an antidepressant, usually called Zoloft and Paxil. Paxil is usually taken for adults 18 years of age and older, while Zoloft is usually taken for children 6 to 17 years of age. While it can be helpful, there are some cons of these medications, such as an increase of suicidal thoughts or withdrawal if you are taken off the medication way too quickly. If taken in large quantity or mixed medications, it can cause a condition called serotonin syndrome. According to me.gov, 2 to 12% of people have severe cases of serotonin syndrome. It is a serious drug reaction, usually caused when combining medications that contain serotonin. Now, psychotherapy is a safer treatment for PTSD that has less to fewer side effects. They usually have two types of therapy they use for psychotherapy, which is cognitive therapy, often used with exposure therapy. These ones help you to safely explore your trauma and safely have you be in a group of people where they each explore each of their traumas safely. Today we learned about post-traumatic stress disorder. We talked about what PTSD is, the effects PTSD has on someone's body and their brain, and their treatments. Now, remember, over 250 million people around the world have or have experienced PTSD. You too can be a victim of PTSD, maybe not now, maybe not tomorrow, but maybe in the near future. Now looking back on Philip's story, PTSD may not have a cure, but there are many things for him that helped him take control of his life and make PTSD livable for him. You too can have a livable life with PTSD if you are taking precaution and get the right diagnosis.